Hello, I'm Johnny Miliaccio. I'm a physician assistant here at Ashley Addiction Treatment. Today, I'm going to be talking to you about medication-assisted recovery. This is a really important topic. People in the course of their addiction can typically be very resistant to the treatment methods, both clinical, psychological, and medical. And as family members, friends, supporters of people seeking recovery, since we're not going through that difficulty with substances, we can be sometimes we can see the information more clearly and can be there to support and encourage our loved ones and friends and family members to maybe pursue a method that they were resistant to. And during the course of this lecture, what I'm going to explain is what these medications are, how they work, the risks, the benefits, and we'll start with one quick objection that I get immediately is that a patient will often say, well, I believe in AA. I'm going to do AA. I'm going to do therapy. And I quickly respond by saying that this is only part of your recovery process. And what this slide illustrates is that, of course, through the course of your recovery, medications are going to be used along with counseling, support, resources, nutrition, and so forth. While you're here at Ashley. What medication-assisted recovery is quite simply, it's prescription medications that are used and provided by a medical provider to support your recovery from a substance use disorder. What these medications are not, they're not magical pills. They're not a cure for addiction. Like similar to and that's why the first slide illustrates that these are part of your treatment. Often for the medications we're going to talk here, the objection that you're replacing one pill with another doesn't really hold a lot of water, because the pills and substances that are being abused are mind and mood altering. The medications we're going to talk about today are not mind and mood altering. So they don't make you, quote unquote, feel good, which is a characteristic of medications that are often abused. They don't cause withdrawal. They're not addictive. They're not something that you're going to have a problem with in and of themselves. And they're not something you take necessarily for the rest of your life. And this slide illustrates, again, that these are an important tool in the treatment of addiction when used along with counseling, peer support, a 12-step program. They reduce the frequency, intensity of cravings. They dampen or block the experience of feeling high or intoxicated, and they provide a shield against impulsive use. How can they help you? They can help you by supporting you as your brain heals, as you become more involved in recovery work. And the longer you move into sobriety, we know that the chances of staying sober increase. So these are a support to get you into long-term recovery. Alcohol, of course, alcohol use disorder. We all know the negative effects that alcohol can have on the body and the brain. So medications for treating alcohol use disorder, there are 3 that are FDA approved. And what's important about that is that what that means is that enough evidence was gathered in terms of research to support the use of a medication to the point where that information got FDA approval, and that in turn translates to insurance companies paying for it, providers being confident in its use, and patients being confident in its use for its intended purpose. And the 3 are Antabuse, Campral, which is also known as acamprosate, and Revia or Vivitrol, which both are naltrexone. Revia is an oral medication and Vivitrol is an injectable medication, but they're both naltrexone is the active ingredient. Opiate dependence, I don't spend a lot of time on this. This you'll get in other lectures, but a lot of Similar to alcohol, there's brain changes that take time to heal and come back to normal. So again, we're using medicines to support you and keep you sober, to give your brain a chance, like I talked about in the beginning of the lecture. Sometimes you'll see the resistance to treatment that the patient experiences early on as their brain begins to heal. There's less objection. There's less, they're not fighting every aspect of treatment. Medications for opiate dependence. Naltrexone is what we utilize either as the oral medication or as the injectable. How naltrexone works is it is a complete antagonist of the mu receptor in the brain, the opioid mu receptor in the brain. And what that produces is that reduces the desire to use alcohol and opiates. And in the case of alcohol, can reduce the euphoria of the effect that alcohol has on the individual. And in opiates can be a complete blockade of the euphoric effects that opiates have on the brain. So there's a protective factor in that sense, but of course the idea would be to prevent usage. Here, this just covers naltrexone versus Vivitrol. And when I get to the, okay, so here, so naltrexone. Oral, again, also known as Revia, it's taken at bedtime. The injectable is given once a month. The side effects, here's what's important to know, especially if you want to support your loved one who might have difficulty agreeing to these medications. The most important thing to note is that the common side effects are usually mild and temporary. And the fatigue, nausea, headache, dizziness, insomnia, and tenderness at the injection site are all symptoms that people have in the course of using drugs and alcohol. I often point this out to my patients. And the thing with drugs and alcohol is these continue to get worse. They don't get better. With a medication like naltrexone, oral or injectable, these tend to be mild, again, mild. You're not going to be up for months at a time. You're not going to be vomiting profusely for days on end. They're going to be mild and temporary. And of course, the less common side effects, liver toxicity, depression, suicidal thoughts, or behavior. If there's concerns, our psychological and psychiatric providers can provide assessments. But generally, it's very well tolerated. The majority of people do not get liver toxicity, depression, suicidal thoughts, or serious injection site reactions, the overwhelming majority. Precautions. Here's the thing, don't get wrapped around the axle about, everything you read here. These are for your education. And the important thing to know about them is that, that the medical and nursing team do assess the patient for these. So, for example, as inpatient treatment, we do make sure that the person has not had an opioid in at least 7 to 14 days, because that could precipitate withdrawal. Also, an objection that you hear is that, oh, well, I might overdose on it, which is a possibility, but it's not a common occurrence. And really what usually happens if the person makes the decision that they're going to use opiates again, they just let the Vivitrol injection wear off, and then they resume using. And of course, if it affects pain management and can affect some aspects of have emergency surgery, but again, this will not prevent you from having emergency surgery. And oftentimes, the patient will wear a bracelet or a necklace indicating that they're on naltrexone, and anesthesiologists and physicians and medical providers can address emergency pain needs if they know that you have the Vivitrol injection. It can make some things challenging, but again, overall, the number one risk to an individual's life who's suffering from a substance use disorder is that substance use disorder. And here are some, you can see from the slide, some reasons to not get this medication. The important thing is that the medical provider and the patient talk about these together. And but not to have the patient just out of hand dismiss, oh, I could get hepatitis. Maybe I shouldn't have Vivitrol. That's not a good way to assess it. Oh, what if I become depressed? These are all things that these are meant to show that people who actively have these issues, this has to be taken into consideration, not an immediate objection to the possibility. Campril is a medication that helps people stay away from alcohol. It was developed in France, I think, around 30 or so years ago. In a lot of countries, it's available over the counter. In the United States, it's by prescription, and it can help people by affecting the GABA receptors in the brain. This can help people not only maintain their sobriety, in some cases, it can help with post-acute withdrawal symptoms. It can help people with anxiety, brain fog, and so forth. The nice thing about Campril is that it does not affect the liver. So even someone with liver disease, where the liver disease is severe enough to preclude them from taking naltrexone, can take liver disease or can take Campril because it only goes through the kidneys. Now, Campril and naltrexone are not known to react with a lot of medications, so it's okay to use in conjunction with other medications. The dosage, it's usually 3 tablets taken 3 times a day, which can make compliance difficult, but the effects are worth the effort. And again, with Campril, common side effects are usually mild and temporary: diarrhea, dizziness, gas, headache, and dry mouth, which, ask anyone who's been an alcoholic or drinks heavily, these are all side effects they have throughout the course of their drinking. These are not side effects they're going to have throughout the course of taking Campril. Most people get some mild upset stomach, which resolves within a few days. And so, of course, people with kidney disease, unstable depression, suicidal thoughts, similar issues to keep people from really taking any medication. The benefits of taking naltrexone and Campril together. Now, a lot of times my patients will, they're like, my God, Johnny, you're throwing a lot at us here. And I like them to know that I'm not doing this sort of just based on my opinion or how I feel about things, but there are double-blinded, placebo-controlled studies that do show that naltrexone and Campril in combination can be more effective. So both medications are good by themselves, but can be really great together. And I also, again, this is what we reviewed, since these medications are not, they're both such low risk medications, you're not incurring a lot of risk taking them both to help maintain your sobriety. Antabuse has been around for a long time. Regular use of Antabuse is generally not something that we recommend. Antabuse we use for high-risk activities. What are high-risk activities? For some of my patients, as soon as I wake up in the morning, I'm at risk. But for others, it's things like flying on a plane, wedding receptions, concerts, ball games, anywhere where there's a lot of drinking. And there are neat little tricks that you can use, like, get club soda with a lime in it, and then people are less likely to ask you if you want to drink. I also tell people you don't have to talk about your sobriety to everyone. You can always say, oh, I have a stomach issue and my doctor's recommending I stay away from alcohol. Because interestingly, the pressure to drink in social situations, even amongst adults, adults can be very persistent about trying to find out why other adults, trying to get other adults to drink. Just sort of strange, but there you have it. Antabuse, once it's in your system, that for most people, this will induce severe, violent vomiting, flushing, tingling, and burning of the face if you drink alcohol, not if you just take the medication. If you take the medication and you don't drink alcohol, you're going to be fine. A common objection is, what if my perfume triggers it, alcohol-based hand sanitizer, all these things? Well, since you're only using it for high-risk activities, something I tell my patients is, if you're going to go perfume shopping, don't go the day you're going to a wedding reception. if you can all avoid it. Use non-alcohol-based hand sanitizer. And then certainly another one that I hear commonly is alcohol-based mouthwash. And I don't think that anyone would recommend alcohol-based mouthwash for an alcoholic ever. Yeah, this is how the reaction can be quite severe. And one of sort of the benefits of antabuse is it can keep you honest because you're not sure, even with one dose, just how fast your body will clear this medication. And I've had patients who have reacted 7-8 days after one dose. They still vomited, still got the flushing. So this is you're going to use antabuse as a deterrent. Naltrexone and Campril, injectable or oral naltrexone and Campril form the mainstay of treatment. Those support you not drinking. Antabuse is a stopgap measure. Antabuse is kind of like a bulletproof vest for alcohol. Dose usually 250 milligrams is the dose. You can take one dose. Some people would recommend, if you know the event is coming up, take it for a couple of days so it builds up in your system. But even if you forget to do that, definitely take one dose at least to help keep you safe. Because oftentimes after an event, people will quote unquote survive the event sober, but then on the way home, they're overwhelmed and they'll stop at a liquor store, get a drink, stop at a bar, something like that. Now, these side effects are more significant than the other medications, but usually you get these side effects only if you take antabuse on a regular basis. This is for daily use. So one of the nice benefits of antabuse is you can take it as needed. Campril and naltrexone cannot be taken. They're not something that, oh, I'm experiencing cravings. I'm experiencing, I really want to drink real bad, so I'm going to take this stuff and it's going to quell that. It's not. If you do feel that, you can take an antabuse and you're a little bit safer. Precautions, of course, can't drink alcohol. Don't take it if you've drank in the last 24 hours. And then again, medication interactions, all the stuff that we've already discussed. And again, a lot of this is more for if you're taking it on a daily basis. Antabuse, of course, liver disease, kidney disease, cardiovascular disease, diabetes, seizure disorder, and of course, your medical provider will go over that with you. Are these medications for everyone? Certainly not, but please let your medical provider help you figure out if it is and isn't. Don't make that decision for yourself. Even with some medical background, it's really, really difficult, especially in the course of early addiction, to make clear, rational, objective judgments about how you should proceed in your treatment. And the benefits, of course, significant reductions in relapse, people who do relapse, that the relapses tend to be not as strong. A lot of people have told me personally, patients have told me personally that if they do start, it sort of short circuits it and they feel it's easier to reach out for help. So in conclusion, medication-assisted recovery may be a part of your recovery process. Our medical providers here will help you ascertain which of these are for you. When conventional methods of recovery are alone or not enough, medication-assisted recovery may be that missing link. When patients are asked, what are you going to do differently this time after your relapse? Medication-assisted recovery may be that difference. You deserve to live free of the pain and unmanageability of alcohol and other addiction. With commitment and help, you can recover from alcohol or drug addiction. It is our goal and hope to assist you as you consider your options. We're here to help. And I thank you if these are family and friends. Thank you for trusting the care of your loved ones to Ashley. This is a wonderful place with committed, loving providers and clinicians and staff at every level, absolutely committed to Ashley's mission to save lives. And I thank you for listening, and take good care.